Republic Act number 8980. What is Republic Act number 8980? It is an act promulgating a comprehensive policy and a national system for early childhood care and development, providing funds therefore and for other purposes. What is early childhood care and development? RA 8980 defines it as full range of health, nutrition, early education, and social services programs that provide for the holistic needs of children 0 to 6 years. It is full range of services to support the rights of children, which are indivisible: survival, development, protection, and participation. Nutrition interventions at 0 to 6 years old significantly improve psychosocial development and physical growth. Combined interventions to improve both physical and psychological development have greater impact than either or alone. It requires the consolidated efforts from different sectors: health, nutrition, early education, child protection, local governance, communication. Section 1. This Act shall be known as the Early Childhood Care Development Act. Section 2. Declaration of Policy. It is hereby declared the policy of the state to promote the rights of the children to survival, development, and special protection, with full recognition of the nature of childhood and its special needs, and to support roles as primary caregivers and as their children's first teacher. Section 3. Objectives. The objectives of the National ECCD system are to achieve improved infant and child survival rates by ensuring that adequate health and nutrition are accessible to young children and their mothers from the prenatal period throughout the early childhood years. To enhance the physical, social, emotional, cognitive, psychological, spiritual, and language development of young children. Next is to enhance the role of parents and other caregivers as the primary caregivers and educators of their children from birth onwards. And to facilitate the smooth transition from care and education provided at home to community or school-based setting and to primary school. Next is to enhance the capabilities of service provided and their supervisors to comply with quality standards for various ECCD programs, and to enhance and sustain the efforts of the communities to promote ECCD programs and ensure that special support is provided for poor and disadvantaged communities. And last is to establish an efficient system for early identification, prevention, referral, and intervention for the development disorders and disabilities in early childhood, and to improve the quality standards of public and private ECCD programs through, but not limited to, a registration and credential system for ECCD service providers. What is the purpose of RA 8980, or the Early Childhood Care Development? Section 4, or the purposes of this act. First is early childhood care and development system refers to the full range of health, nutrition, early education and social services programs that provide for the basic holistic needs of young children from birth to age 6 to promote their optimum growth and development. These programs include center-based programs such as the daycare service established under Republic Act No. 6972, public and private preschools, kindergarten or school-based programs, community or church-based early childhood education programs initiated by non-government organizations or people's organizations, workplace-related child care and education programs, child minding centers, health centers, and stations. Second is home-based programs such as the neighborhood-based play groups, family daycare programs, parent education, and home visiting programs. ECCT service providers include the various professionals, paraprofessionals, and volunteer caregivers who are directly responsible for the care and education of young children through the various centers and home-based programs. They include, but are not limited to, a daycare workers, teachers, teacher aides, rural health midwives, social workers, community health workers, barangay nutrition scholars, parent effectiveness service volunteers, child development workers, and family daycare providers. ECCD curriculum refers to the age-appropriate and developmentally appropriate educational objectives, program of activities, organized learning experiences, and recommended learning materials for children that are implemented by service providers through center and home-based programs. It shall consist of national program goals and guidelines, instructional objectives, and content outlines integrating local learning experiences and indigenous learning materials. Next is parent education refers to the various formal and alternative means of providing parents with information, skills, and support systems to assist them in their roles as their children's primary caregivers and educators. These include public and private parent education programs linked to center, home, and media-based child care and education programs. Let's proceed to Section 5, which is the system framework and components. The ECCD system shall include the following components. First is ECCD curriculum, which focuses on the children's total development according to their individual needs and socio-cultural background. It shall promote the delivery of complementary and integrative services for the health care, nutrition, early childhood education, sanitation, and cultural activities. It shall use the child's first language as the medium of instruction. Next is parent education and involvement, advocacy, and mobilization of communities, which harness and develop parents' strengths as providers of ECCD at home. Active partners or other stakeholders, advocates for community concerns that affect children, and pillars of support for local and national ECCD programs through community organizations efforts. Next is Human Resource Development Program, which it establishes mechanism for the systematic professionalization of ECC service providers through enrollment in educational programs in site-based or distance educational modes through pre-service or in-service training, including continuing education programs, whereby a registration and credential system shall be developed in the ECCD system. Next is the ECCD management, which it focuses on a continuing process of planning, implementation, supervision, financial management, monitoring, evaluation, and reporting. It shall encourage the active involvement and build the capabilities of service providers, parents, and local government officials to sustain the program, and it shall be guided by the principles of decentralization as stipulated in the Local Government Code of 1991. And last is the quality standards and accreditation, which it ensures that each component in ECCD system complies with national quality standards to be established by the National ECCD Coordinating Council as provided for under Section 8 of this Act, linked to an accreditation process.